Ah, hello there. How have you been? It's been a couple weeks, hasn't it? I know. I know you like to get in your, weekly doctor's appointments, and that's how we kind of do it down here. But recently, I have been extremely busy studying for my license exams. You see, I'm an SCP, so I'm not technically allowed to practice medicine in the conventional terms, if you would say. So I have been studying and writing down many different notes and different things about medical practices that I've read from the books the guards have given me and other things that I've extrapolated from my different appointments that I have had with my patients. It's been a wonderful learning experience. You, in particular, have been quite the source of learning when it comes to my medical practices. In any case, what brings you into Dr. Birb today? Ah, you're not feeling too well. I see. Would you mind if I wrote down some notes? You wouldn't? Great. And can you remind me of your name and date of birth, please? Great, thank you. Alright, and what seems to be the problem? You think you may have the plague. Very interesting. I haven't heard of anyone getting the plague for at least 2 days, maybe more. Very interesting. Those do sound like symptoms of the plague, but let's look at that further. I think I have the right test in mind for later, but let's get down some of the information, just to be sure. Alright, now, are you experiencing some fevers or chills? Okay, I see. And how is your stomach? Are you having any nausea at all? A little bit? Not too much? Okay. On a scale of 1 to 10, what would you rate your nausea at? A 3? Okay. That's pretty low, so that's good. Are you getting any aches or chills? Sometimes? Okay. Alright, and some just other general questions. Are you taking any medications? Have you started any new ones? Or have any continuing ones? Okay, and what would those be? Okay, and what is the other one? Okay. Okay, and that one's just for allergies? Okay, I see. Alright, excellent. I think that will do it for some of the notes that I just want to take. I do think that this may indeed be the plague, and the test that I would like to run is a blood test. I know it's a little unconventional and a little different, but I think that that will be the quickest way to determine whether or not you have the plague. Are you okay with that? You are? Excellent. That's wonderful to hear. It'll make this much quicker for both of us. Let me put my notes down. Alright, so what I'm going to do is I'm going to draw your blood, and I'm going to use this little syringe that I have here. It comes apart very easily. These are 2 pieces of a very hard plastic that's resistant to bacterial growth. Although this syringe doesn't have a traditional needle at the end, it has many very fine points that are invisible that will make this process painless and extraordinarily quick. So you don't have to worry about any pain. If anything, you may feel a slight tingling sensation, but that would be it. Alright, let's continue. Alright, so what I want to do now is I want to try to find a good vein on your arm. I'm going to use this flashlight since it's a little dark in this room, I'll admit. The atmosphere is very calm and relaxing, and sometimes that comes at the price of some of the light that I have to work with and with my lenses. I can't see as well, so, or I should say it's darker, so it becomes a little hard for me to find a good spot to draw blood from. Alright, this will be a little bright light. I'll be shining it mostly downwards towards your arms. So let's start with your right arm, shall we? Can I have your arm? Thank you. There's a couple good veins here. I'm going to keep looking. That one right there is a particularly good one. You know what? I think that could be a good candidate on that arm for sure. Let's look at your left arm, please. Thank you. This one doesn't have as many veins. Some that may be okay to use. I think that I'm going to go with your right arm. That seems like it has the most veins. Also, while I'm here, do you mind if I check your eyes real quick? I kind of noticed that they looked a little bit glazed, and that was something that I thought could be a symptom of the plague. You don't mind, do you? It'll just be a quick, brief overlook of your eyes. Excellent. Thank you very much. Alright, I'm just going to shine this light in and out of your eyes to see how you respond. Alright, now let's look at the other side. Your eyes do seem a little hazy, but that's to be expected. Alright, overall, they look okay. A little bit of haziness, so that could definitely be something to be aware of. Alright, what I'm going to do first is I'm going to take this cotton swab and I'm just going to wipe off the site. I also have for this cotton swab a solution of antiseptic. This will help keep the site clean. It will also numb it so you won't feel a thing. It should be a very relaxing experience. Alright, now let me wipe down this pad real quick. Alright, now I'm going to put this down. I'm going to apply this to your arm. Make sure I get that on there. Alright. Now I'm going to throw this away. Alright, now we will use the syringe and I will put it in, and I will also include a vial which I will drain the blood into. Alright. Are you ready? Okay. You have nothing to be worried about. This should be smooth as butter, as they say. Alright, here we go. Looking all good so far? Alright, and then I'm going to deposit this in the vial. Alright. And there we have it. Let me wipe off the area again. Alright. And we have your vial of blood. Look at it. Look how red it looks. It's a very good draw of blood. Oh, I almost forgot. Let's get you a Band-Aid for that. I agree. It would probably be the best option. Alright, now if you can put out your arm for me. There we go. Right as rain. Alright, now for the last part, let's examine your vial of blood. It's very red in coloration. I noticed some shiny material in here. I'm not sure what that's about. That may be the plague, in fact. you may just have a very high concentration of it. Nothing to worry about. It is very treatable. In this day and age, I should say. So, no worry. Let me get a better light on this. Hmm. Well, my friend, in my medical opinion, I do think you perhaps have the plague. Now, I will recommend to you some different treatment options that we have available right now. And additionally, if you don't mind, I would very much like to hold on to this sample, unless you really want it back, because I can do that if you so desire. No? Are you sure? It would only be another minute. Alright, very well then. I will keep this for myself. Thank you very much. It is a very fine specimen of blood. It will be a fine addition to my collection. I mean, samples. Alright, now let me get you those meds that I think will be a good starting point for treating this. Alright. Now, you're going to want to take one of these a day. And then every full moon, you'll take 1.5 doses. Does that make sense? Okay. And then after about 2 weeks, we'll check back in and we'll see how you're feeling. Alright, I will stop stalling with these wonderful sounds and I'll give you your prescription. Alright, well, I think that will wrap up our appointment today. I hope that I have been able to give you some good care and that you feel more at ease now that Dr. Birb has talked to you. I hope that soon you feel much better and you can feel strong enough and relaxed enough to get a good night's rest. Yes. Well, in that case, I am glad that you stopped by today. It always makes my day to make my patients happier and help them. It was great to see you again. I hope to see you soon. All right. Take care, my friend. Goodbye.